Hi, my name is Grace,
And my name's Andras.
and today we're going to talk to you about our literature review on the PICO question. In women of childbearing age, does the use of antioxidant supplementation therapy result in symptomatic relief of endometriosis pain as compared to no antioxidant supplementation therapy?
We were interested in if antioxidants would be an effective method in reducing pain, and they could be used in place of or in conjunction with traditional treatments like NSAIDs and combined hormonal birth control. Endometriosis is a chronic and often painful condition in which the tissues that typically line the interior of the uterus, called the endometrium, begins to grow in other places. It occurs in roughly 10% of women. This tissue is typically on the inside of the uterus and on the ovaries, but endometriosis can spread to other places like the bowel, bladder, and other organs. Despite growing outside the uterus, the endometrial tissue that has grown and adheres to other areas acts as it normally would, meaning that it builds up and breaks down with each menstrual cycle. Because this tissue has nowhere to go, the surrounding tissue becomes inflamed, swollen, and can be very painful.
Endometriosis can also cause scar tissue buildup, infertility, cramping, painful intercourse, digestive issues, and abnormalities in menstruation. Oxidative stress due to endometriotic tissue is thought to contribute to this pain. Because antioxidants reduce oxidative stress, they may be able to help reduce pain. Many compounds contain antioxidant properties. These include lots of fruits and vegetables, vitamins, and even the hormone melatonin. While research on the topic is quite limited, we were able to find 4 research studies that investigated our PICO question. One study, called Antioxidant Supplementation Reduces Endometriosis-Related Pelvic Pain in Humans, that used vitamin D and C as sources of antioxidants. This study found that 43% of the participants in the experimental group had a reduction in chronic everyday pain, while 52% had no change in everyday pain. Of the patients in the experimental group who saw no change in everyday pain, 22.7% of them indicated a decrease in menstrual cycle pain, or menses pain. In the control group, none of the participants felt a change in everyday pain levels, but 45% of this group indicated less pain during menses.
The second study that we looked at was called Effectiveness of Antioxidant Preparation with N-acetylcysteine, alpha-lipoic acid, and brolamine in the treatment of endometriosis-associated pelvic pain. They found that a combination of N-acetylcysteine, alpha-lipoic acid, brolamine, and zinc over 6 months significantly reduced endometriosis-related pain.
The third study, titled Effects of Vitamin D on Endometriosis-Related Pain, a Double-Blind Clinical Trial. This study looked at the use of vitamin D over 12 weeks in reducing endometriosis-related pelvic pain. In order to qualify as a participant for this study, women had to be 15 to 41 years of age, and they used participants who had recently undergone laparoscopic surgery to diagnose or remove endometriosis tissue. This study ultimately concluded that vitamin D was not an effective antioxidant for reducing endometriosis pain.
The fourth study was called Efficacy of Melatonin in the Treatment of Endometriosis, a phase 2 randomized double-blind placebo-controlled trial. This study found that melatonin, because it was a free radical scavenger or an antioxidant, that taking 10 milligrams of melatonin nightly over the course of 6 months significantly reduced endometriosis-related pain. Additionally, the study found that the placebo group was 80% more likely to require supplemental analgesics such as Tylenol or Advil as compared to the treatment group who received melatonin.
Looking at the available studies, there appear to be mixed conclusions overall. 3 of our 4 studies found that their supplemental therapy reduced endometriosis-related pain in at least some of the participants, but the clinical significance of these results is uncertain, in part due to the fact that all of these studies had very small sample sizes and that they each used different sources of antioxidants. In general, more research is needed in order to better develop an accurate portrayal of how antioxidants can impact endometriosis pain.
In nursing practice, this information may be useful because if antioxidants can help reduce endometriosis pain, then they can be taken by patients who either cannot use traditional treatments for whom the traditional treatments are not effective. Again, these traditional treatments are typically NSAIDs and combined hormonal birth control. Additionally, this research could be used to help supplement traditional treatments. Reducing overall chronic pain for patients improves their quality of life, and if this treatment is proven effective in the future, can make a large difference in the lives of women who are suffering from this condition.